Next speaker is Dr. Elizabeth Taylor of the Unit Head of the Tripartite Joint Secretariat of World Health Organization. She's to talk about antimicrobial resistance, a One Health challenge. She's to give us thoughts by way of video.
Good afternoon, and it's a real pleasure to be here. My name is Dr. Liz Taylor from the World Health Organization, where I'm the unit head of the Tripartite Joint Secretariat on Antimicrobial Resistance. And so I'm now going to shift to sharing some of my slides, if you will just excuse me. Amazing how it always takes a little bit of time for this to happen. Great. So, very keen to talk to you, first of all, about why AMR is a One Health issue, and then why it needs to be, and what we are doing about it, both through the Global Action Plan at global and country levels, and then governance structures and actions within the Tripartite Secretariat where I work. So over the last couple of years, there's been a growing interest in One Health issues, not just for AMR, but across through zoonoses, issues like rabies, neglected tropical diseases, food safety, and they all come under this One Health umbrella, whereby we realise that sectors are interconnected, the problems are related to each other, and if we are going to have sustainable solutions, we need to work together to address these issues. We're talking primarily about human health, the food and feed production, animal health, and including here in the food production, not only livestock, but fish production, and increasingly we're worried about plant production with AMR, but also these come into the environment as a common endpoint where transmission is a major, both the development of resistance and transmission is a major issue. So all of this is a very good example of one of the wicked sort of problems that the Sustainable Development Goals were designed to address. And to achieve real sustainable progress in AMR, it is important that we work and make progress in several of the goals. But also, if we don't achieve the Sustainable Development Goals, if we don't address antimicrobial resistance, we will have significant problems in making progress towards the SDGs, progress towards sustainable food production, certainly sustaining universal health coverage and the health goals will be much more difficult in the context of antimicrobial resistance. And so it is something that is important across all the SDGs, but the indicators are based in the health goal. And these are relatively new indicators. They were agreed in the last 2 years. One, about access to antibiotics, because access is extremely important. And that we have the right appropriate antibiotics. So this is one about the proportion of health facilities that have a core set of the relevant essential medicines, including antibiotics, available on a sustainable basis. And we are encouraging countries to look specifically at their antibiotic provision. The other one is about the percentage of bloodstream infections due to AMR organisms, focusing particularly on CRE and on MRSA. So how have we got into such a problem with antimicrobial resistance? And one of the issues is that they are part of the infrastructure of our health system. And they are very widely used both to prevent and treat infection. But they're also being used as a substitute for the lack of water, sanitation and hygiene facilities within countries. Many countries have no running water supply and no functioning toilet. If this is your water supply for a hospital, it's difficult to do hand hygiene. Facilities are dirty, facilities are overcrowded. These pictures are taken from Africa, but there are major problems with infection prevention and control across the world. Antibiotics are also often used as a substitute for good care. Rather than having a professional consultation, this man is attending a market stall and there is a whole range of antimicrobial products, many of which may be of substandard quality, and neither the vendor nor the person buying it probably knows what they are or what the indications. So it's an ad hoc, suck it and see approach. We also know that antibiotics are a very good way of facilitating quick consultations. When doctors are tired, when they are overpressed, when health workers lack confidence, a prescription of antibiotics is often used. So in overpressed, overstretched health services, the numbers of consultations where an antibiotic prescription is given, whether appropriate or not, can be very high. And this in particular is something which is prevalent right across the world. But this is not just an issue for human health. The same issues occur in the animal sector. There is a big move towards increased intensive meat production. And in many cases, antibiotics are being used as a substitute for decent hygiene and decent care. And so in overcrowded, dirty facilities, or where animals are stressed, antibiotics are often used to prevent widespread infection. In addition, low-dose antibiotics are often fed to healthy animals to accelerate growth and weight gain. We have quite strong guidance against this, but it is still quite prevalent in many countries. This shows this is data just from Europe, showing the massive difference in the amount of antibiotics that are being used in agriculture. Now, meat production in Norway and these countries, including Denmark, a massive meat producer, is very high and very efficient. But we can see that there's a sort of more than tenfold difference in the amount of antibiotics being used. And this is probably due to animal husbandry practices and fashion and culture. So there is huge scope to decrease the amount of antibiotics that are being used. And what is encouraging is that we are seeing in many countries that they are actually starting to reduce the amount of antibiotics that are being used, certainly per kilogram of biomass. And the 5th report of our sister organization, the World Organization for Animal Health, is showing this encouraging data, which confounds some of the rather gloomy academic literature that was suggesting that the use in agriculture would rise very, very significantly over the next decade. But on a much more worrying note, we are increasingly realizing that antibiotics and antimicrobials more generally are being used very widely in plant health. Now, tracking the use of antibiotics in plants and proving that it causes resistance is more difficult. But we certainly know that this happens with fungi, where the azoles used in the tulip industry have been closely linked and proven to result in drug-resistant Aspergillus infections. We are very worried that in countries such as California, tons of streptomycin and tetracycline are being sprayed on citrus fruits. And this obviously is a significant risk of resistance. A lot of antibiotics are used in rice production and in several other crops, often just mixed in with other pesticides and not regulated closely at all. And these antibiotics that are sold by the kilo are extremely cheap and widely used. The other area where I think over the last few years we have realized very significant risk is in the environment, whereby the metabolites of antimicrobial compounds are found in wastewater, whether through manufacturing or through the excretion from humans and animals getting into the wastewater thereby. And we know that in many countries, this water is used for bathing, washing, and drinking. Often there can be very high concentrations of antimicrobials in the water and other compounds that can also facilitate, and heavy metals that can facilitate the development of resistance. So there is a major risk of the contamination of the environment. So really need to work with our environmental organisations and ministries to tighten up pollution controls. And we are delighted that our sister organisation UNEP will be presenting a major report on this next month. This really just shows how whether we are looking at the use in health facilities, in the community, from manufacturing, from food production, from animals, from aquaculture, from plants, there is a common path and it is all interrelated. And this is why we really do focus on this being an absolute One Health issue. It's important we don't get into a blame game. We are all responsible for the abuse of antibiotics. Effective antibiotics are important for the treatment of sick animals, for maintaining livestock production. And so this is something that we have to solve and address collectively. I always find that it's, in talking about this, because people come from such a wide range of backgrounds, it's important to just remind ourselves how resistance is developing. That it's not only the selection pressure from the antibiotics resulting in sensitive bacteria being killed, resulting in the proliferation of drug-resistant strains. There is also plasmids, which can have a package of DNA and can result in the transmission of that package of resistance, even between different strains of bacteria without sexual reproduction, just being in close proximity. And this complicates the whole issue massively. The other thing, I do a lot of work with the TB community, with TB colleagues, and it's important there to point out that the resistance of bacteria is very often occurs in the microbiome, in the gut, and so it's not necessarily the infection that is being targeted where the resistance develops. So very often treatment of another infection will result in the resistant strains developing, and then when the patient becomes sick again, it is with that resistant strain that causes the problems. And this is another rather nice but complex diagram that just shows the interconnectedness of the different systems of human health, food production, aquaculture, and even wild birds and insect vectors that can be associated with spreading food. And again, the next slide, really, how does an infected strain get from a chicken that's been overfed with antibiotics and develop resistance to the human. And it can be through food, that the chicken is slaughtered, and then contaminated food, or the food is contaminated with resistant bacteria at the slaughterhouse and gets inappropriately cooked, so we get into our human microbiome. It can also be the slaughterhouse or the farm worker exposure, and we see quite significant levels of resistance in these populations. But also the poultry waste can be spread on the soil, it can get into the water, and then we get community exposure. So although the food chain and food hygiene is important, it's also important to remember that there are these other mechanisms of transmission. And so the human-animal interface is porous and the risks of resistance spreading are high. So does this matter? Well, a few years ago, we had the report by Jim O'Neill and the UK Independent Review, and that came out with the rather scary number that there might be 10 million annual deaths by 2050. But in the Lancet, at the end of January 2021, we've had a new report and analysis from the Institute of Health Metrics and Evaluation on the global burden of AMR. And this is showing that 1.3 million deaths already are being directly caused by bacterial AMR. This isn't even including the resistant deaths from malaria or from HIV. Just bacterial AMR, we're looking at 1.3 million deaths directly caused, and there are almost 5 million where there is an association with bacterial AMR. If we look at this in terms of disability life years, or DALYs, then it's particularly serious because so many of these deaths are in children, in neonatal sepsis and in childhood infections, which are now becoming resistant and difficult to treat. And although a lot of the discussion and concern about antimicrobial resistance has very much focused on, has been driven from Europe, Japan and the Americas, in fact, it is emerging countries, sub-Saharan Africa, that will have the highest burden of AMR. And these are the countries that have the least resilient health systems. They will be least able to afford more expensive antibiotics or higher treatment costs. So what are we doing about this? And when the Global Action Plan was agreed, all countries agreed to develop their own action plans to address AMR. And as a part of that, it's important to have a multi-sectoral coordination committee to really pull the sectors together and work. And there has been substantial progress in this. Our latest survey in WHO suggests that about 60% of the countries that responded, and that's 115 of the 193 in the world, and most of the big countries, as you can see on this map, they have some sort of functional multi-sectoral coordination group. And this is critically important. And that coordination is generally between the human and the animal health. And as we can see, we track this every year, that a growing number are also including food production, the environment, food safety, and plant health. So I mentioned earlier the Global Action Plan, and this, I'm sure many of you are familiar with, was developed in 2015 and passed at the World Health Assembly, but then also endorsed by the governing bodies of the Food and Agriculture Organization and the Organization of Animal Health. And they have developed their own plans reflecting the Global Action Plan. And it has 5 objectives, very much like many good public health programs. And now I'm just going to go through and outline what is going on and what is being advocated, particularly with a One Health lens. As we say, as of this May, 144 countries, a vast proportion of the world's population are living in countries that have national action plans. The challenge now is implementing them at scale in a sustainable way. And we are still very short of the adequate resources, particularly in low-income countries, to achieve that. So we have a problem with AMR with the language and the fact that many people are still unaware of the scale of the problem, or really what it is. And the scientific literacy of the policymakers and the public has not been high. But this has changed significantly with COVID. And I think it has demonstrated that people can understand epidemiology and become their own experts on vaccine manufacture, but we still have a lot of work to do to help people to understand what antibiotics are in particular, but are they antimicrobials, and why and how their abuse can result in problems. There's another huge area around educating the professionals, health professionals, and farmers and vets. And certainly when we looked at this, and we've looked at it in several countries, the education of health workers on antimicrobials and use of antibiotics is, a great deal more needs to be done to give people confidence to use antibiotics appropriately and not use them. And also health professionals are obviously great advocates for policy change, because it is the future generation of health workers that will really have a struggle, and vets, if the antibiotics are no longer working. We still need to build the evidence base on the scale of the problem and really understand where antibiotics are being used, in which food chains, how much, why, and is what we are doing making a difference? Is resistance level going up or down? Are consumption patterns going up or down? So there's a whole work stream on developing surveillance systems, both of resistance and also of consumption patterns in human health, but also in the animal sector, livestock food production. And little has been done so far around plant health, but this is another area where we must do more. It's quite difficult sometimes to pull all this data together. And so one pilot that we use, and many countries are now adopting, is called the Tricycle project, that looks at extended spectrum beta-lactamase in E. coli. And it looks at them in humans, healthy animals, food, and the environment. And in just looking at, it's one drug-bug combination in a standard way, it's helpful to explore the linkages and also start to see differences between countries. And it's a relatively simple protocol that is being rolled out. So looking at the human sector on hospitals, both sick patients and community carriage, looking in the food chain at live birds in a big local market, in the environment, and then linking them up. So that's the surveillance thing, but one of the key things that we have to do is to reduce the incidence of infections overall. This is important in the human health, but also in animal health and in the environment. So we're talking about vaccination, we're talking about hand hygiene, we're talking infection prevention control, we're talking about biosecurity in food production, and we're talking about wash and wastewater. And as you can see, there is a range of guidance across the sectors that is being produced. The challenge now is to get that to be taken to scale and used at scale. So now we're coming to thinking about how do we optimize use. And in 2019, WHO developed something called the AWARE classification, which breaks down antibiotics into the access group, which are the frontline antibiotics for most common infections that should be available at all times, affordable and quality assured. The watch, which are the ones that we are worried about, and we are particularly where resistance is more likely to be developing, or which are used, should be used into more care and by ID physicians, and then the reserve, which are really the last resort drugs. And we are now monitoring the use because we would encourage that we should expect 60 to 80% of the antibiotics being used being in this access group. And these are the ones that need to be available in primary care. And this then links to what we're asking our colleagues in animal health to do, and saying that the critically important antimicrobials for human medicine, which are effectively largely those on the watch and reserve list, should not be used for metaphylaxis and should be used with extreme care to avoid contamination and getting into the food chain. We do acknowledge that occasionally antibiotics, and some of these critically important antibiotics, will need to be used, but only under extreme care when the others have been excluded, and for treatment under the use of a vet. And in all of this, it's just very important that we balance access with inappropriate use. And in many countries, we have to improve access, particularly to the first-line drugs. And we are having major problems now with shortages and stockouts. The market for antimicrobials is very difficult, both for development, which is there are only a very few producers, and drug discovery and taking drugs to the market. There is a major problem because the antibiotic pipeline is dry and the incentives for manufacturers are weak. And we talk a lot about the need for antimicrobials for human health, but we do need to remember that they're also important for animal health. So we have to think of other systems to address this. Codex Alimentarius, the food standards, international food standards, have just developed guidance on integrated surveillance and a code of practice. And this is another way of rolling out and taking to scale effective measures. We also have a compendium of international instruments that are relevant to antimicrobials in human, animal and plant sectors. So in order to do this, a One Health response needs the 4 agencies that are important, that are most relevant to come together, and that is why we come together as a tripartite. And this year we have become now the Tripartite and UNEP Secretariat for Antimicrobial Resistance. And we encourage countries to work through the UN system, through development cooperation frameworks, to take AMR into their plans, into their development plans going forwards. We've also developed and supported the Global Leaders Group. This is chaired by the Prime Ministers of Barbados and Bangladesh, has the 4 Director General of the 4 organisations as ex officio members, and a range of global leaders from across, and acting ministers and experts from across the world and across the different sectors. And this group has been very active and over the last year have come out with quite strong position papers on many issues such as climate change, financing, supporting the Codex guidance and on integrated surveillance. We want to broaden it, which is why we are developing a partnership platform, the AMR partnership platform, pulling together member states, the private sector, academia, the public sector, and NGOs to debate, come and pull together, share ideas, knowledge, evidence, and keep the momentum going. So this, we hope, will be launched within the next few months. So just in summary, and this comes back to the interagency coordination group, we need to have this multi-sectoral approach to protect antimicrobials for human health, but also for animal and plant health. And we need to work with our colleagues in food production, through the environment for pollution controls, provision of water and sanitation, so that we and our future children can have the privilege of these antimicrobials, which are so vital for treating infection and ensuring that modern medicine, the gains of modern medicine, can be sustained for future generations. Thank you very much for listening.
ありがとうございました。
Thank you very much, Dr. Taylor.